stars with the power to be seen across the world. We're not the future, we're the present. Invest in us and you will see the world is changing.
Because our bodies and the future we hold it. We want for you to see that everybody can win. Could it be education or contraception? Everyone will always be here to sing.
We are family and we are planning to go around the world telling everyone that we demand a voice. We are family and we are planning to go around the world telling everyone that we demand a choice. We on the ground in every area. We're the ones to make a world a better place. We want the best, we want the way. There's something for a future so bright.
Because our bodies and the future we holding. We want for you to see that everybody can win. Could it be education or contraception? Girls and boys, we always be fine.
We are family and we are planning to go around the world telling everyone that we demand a voice. We are family and we are planning to go around the world telling everyone that we demand a choice.
We gon' climb up and then rise up. Won't keep our eyes shut, we ain't got enough. I know you tired of seeing things the same way, but in time you realize that things change. We the demographic dividend. You see the work that we putting in. I'ma stay true to me and use my opportunity to show you how to build a community with unity.
உன் வாழ்வு உந்தன் கையில், எதிர்காலம் உன் கண் முன்னில். மனதையும் உடலையும் பாதுகாப்பாய். வேண்டும் வேண்டாம் என்று சொல்ல உனக்கு மட்டும் உரிமை உண்டு. தேவையில்லா குழப்பம் நீக்க வெவ்வேறு பல வழிகளும் உண்டு. உதவக்கரங்கள் உண்டு, முன் வந்து சொல்வாய் என்று. உதவக்கரங்கள் உண்டு, நீ முன் வந்து சொல்வாய் என்று. இன்றே முடிவு செய், உடல்நலத்தை உயர்த்தி வை. இன்றே முடிவு செய், உடல்நலத்தை நீயும் உயர்த்தி வை.
Because our bodies and the future we hold. We want for you to see that everybody can win. Could it be education or contraception? Girls and boys. We'll always be fine. We are family and we are planning to go around the world telling everyone that we demand a voice. We are family and we are planning to go around the world telling everyone that we demand a choice.
graced us with the power to be seen across the world. We're not the future, we're the present. Invest in us and you will see the world is changing.
Because our bodies and the future we hold it. We want for you to see that everybody can win. Could it be education or contraception? Everyone will always be here to sing.
We are family and we are planning to go around the world telling everyone that we demand a voice. We are family and we are planning to go around the world telling everyone that we demand a choice.
We on the ground
In every area, we're the ones to make a world a better place. We want the best, we want the way, and there's something for a future so bright.
Because our bodies and the future we holding. We want for you to see that everybody can win. Could it be education or contraception? Cause the boys we always be fine.
We are family and we are planning to go around the world telling everyone that we demand a voice. We are family and we are planning to go around the world telling everyone that we demand a choice.
We gon' climb up and then rise up. Won't keep our eyes shut, we ain't got enough. I know you tired of seeing things the same way, but in time you realize that things change. We the demographic dividend. You see the work that we putting in. I'ma stay true to me and use my opportunity to show you how to build a community with unity.
உன் வாழ்வு உந்தன் கையில், எதிர்காலம் உன் கண் முன்னில். மனதையும் உடலையும் பாதுகாப்பாய். வேண்டும் வேண்டாம் என்று சொல்ல உனக்கு மட்டும் உரிமை உண்டு. தேவையில்லா குழப்பம் நீக்க வெவ்வேறு பல வழிகளும் உண்டு. உதவக்கரங்கள் உண்டு, முன் வந்து சொல்வாய் என்று. உதவக்கரங்கள் உண்டு, நீ முன் வந்து சொல்வாய் இன்று என்று. இன்றே முடிவு செய், உடல் நலத்தை உயர்த்தி வை. இன்றே முடிவு செய், உடல் நலத்தை நீயும் உயர்த்தி வை.
Because our bodies and the future we hold. We want for you to see that everybody can win. Could it be education or contraception? Girls and boys will always be fine. We are family and we are planning to go around the world telling everyone that we demand a voice. We are family and we are planning to go around the world telling everyone that we demand a choice. We are family and we are planning to go around the world telling everyone that we demand a voice. We are family.
Good morning, good afternoon, good evening, everyone. On behalf of the IBP Network, I'd like to welcome you to this session on the power of partnerships. My name is Sarah Mazurski, and I work at the Johns Hopkins Center for Communication Programs. I've personally been a member of the IBP Network for 14 years, and I'm so pleased to see so many familiar names, as well as several new ones joining us today. We have an exciting agenda for you. Today, we will be beginning with a panel on the power of partnerships, where we'll have representatives from IBP's founders talking about how powerful partnerships are to advancing our collective mission. From there, we'll move to a presentation where we'll talk about where IBP's been and where IBP is headed. And from there, we'll move to a presentation from you, our partners, doing what you do best, which is sharing resources and tools to help advance the field of family planning. We do have a few logistical items to note. If you need interpretation, you can choose French or English at the bottom of your screen so that you get the appropriate translation at the appropriate time. If you have questions, you can put them into the Q&A, and if we have time, we'll be able to address them. This session, as you can see, is being recorded. And lastly, if you do have a phone, please keep it handy, as we'll have an interactive part of the session where we will have an opportunity for audience response. And without further ado, I'd like to introduce the moderator for our panel. He truly needs no introduction, as he's been at the helm of innovative family planning programming for years. But please allow me to introduce Pop Guy. He serves as President Emeritus at IntraHealth International and has been a champion of IBP and family planning for decades. Pop, welcome, and over to you to introduce our panelists.
Thank you so much, Sarah. Thank you for the introduction, and good morning, good evening, good afternoon, everyone. Let me just start with a few words before I introduce our panel. I think there is cause for celebration in a lot of ways, despite the difficult conditions we are all living in. We just saw the report of FP 2020, and of course, as of July, we see that 60 additional women around the globe, in the 69 focus country of the FP 2020, we have 60 million additional women who have embraced contraception. We have also a statistic I'm very proud of. We've seen a 66% increase in growth of family plan, a modern method in Africa. And these are telling, because this is really, when we talk about partnership, that's what we want to focus on, is what it's going to lead to. Clearly, we're here today to celebrate the IBP. And because it has been instrumental in this progress that we are witnessing and that we're going to be hearing from our illustrious panel today. I want to say a few words about partnership, which, as we know, represents goal number 17 in the SDG. We are all called, regardless of the sector that we work in development, to find ways to do better in partnership. It is very clear that we have some new challenges that is going to require for us to do better in partnership. IBP indeed has been a critical methodology, a critical approach to get us together to continue our learning. So as we go through this panel, I would like to invite us to also be thinking about what is it that we're going to keep, what is it that we're going to change, what is it that we're going to improve on, because we have some new challenges and some opportunities. One thing I would say about the challenges, the biggest one, thanks to COVID, unfortunately, is maintaining the gains that we have made. I also, unfortunately, we have to find ways to broaden the tent, because one of the big obstacles we have moving forward is still the people who are not convinced. people who are not nodding when we what we say. We need to broaden the tent and bring at the table, find ways to convince those people who are not convinced. And among the new opportunities, of course, we have youth and investing young people. We've got technology, and we've got an array of new players who have embraced the field of development, especially our friends, social entrepreneurs, and so forth. So, and also all of us now have to work in a new world with new realities. The conversation about systemic racism in the United States, broad global conversation on decolonizing global health are a reality and has created a new platform for us to be thinking partnership. So I'm going to introduce our first panelist, but I just wanted to invite our panelists as they make their remarks to also be thinking about this, because our new agenda is really one of acceleration, because we cannot afford to take how long the have taken where we are. I think with what's here in terms of resources, in terms of technology, should allow us to make progress. So I think we should dare to commit to rapid acceleration of the progress so we can leverage all these opportunities that are here. We've got, as I said, an illustrious panel today. And I'm going to start by introducing our first panel, Jan Askew. Jan is the director of WHO's Department of Sexual and Reproductive Health and Research, which includes UNDP, UNFPA, UNICEF, WHO, World Bank Special Programs of Research Training in Human Reproduction. In his role, he provides leadership on critical aspects of sexual and reproductive health and rights by shaping the global research agenda and coordinating high-impact research, setting norms and standards for delivering sexual and reproductive health services, articulating ethical and human rights-based approaches, strengthening research capacity of institutions in low and middle-income countries, and guiding efforts to achieve WHO's vision of a world in which all people attain the highest possible standard of health and well-being, including their sexual and health. I am so proud to also count Jan as a longtime friend. Jan, over to you.
Thank you so much, Pat, for that lovely introduction. And good morning, good afternoon, good evening, everyone. It's a real pleasure to be here. And I'd like to thank the session organizers for bringing together Ellen, Gifty, Phila, and I to provide our various perspectives on the IBP. It's a real pleasure for WHO to participate in this panel to reflect on the role of the IBP network, as Pap was suggesting, because it is one of the key global partnerships for family planning and increasingly for other sexual and reproductive health services. Having been among those involved with IBP since its inception, I've been able to witness firsthand its remarkable growth and resilience over the years, demonstrating the clear need for the truly global partnership. As WHO, it is truly an honor for us to host this remarkable partnership and to support the many partners in whichever ways we can. WHO is itself fortunate to host IBP for many reasons, and I believe that it is also beneficial to IBP that it has a home here at WHO. As our Director General, Dr. Tedros, says, we are the world's health organization, with the mandate to provide global leadership so that everyone everywhere can enjoy their human right to the highest attainable standard of health, including sexual and reproductive health. We do this by developing normative guidance so that those providing health services can do so based on the best available evidence. Much of our work is focused on generating and synthesizing new evidence of what works and how to strengthen service delivery through primary health systems so that all people can access the information and services they need. Through hosting the IBP network, we're able to have a direct connection with a vibrant and extensive network of organizations that are integral to their national health systems and at the front line of providing family planning and other sexual and reproductive health services. This link is invaluable in helping us to share directly our guidance products with organizations needing evidence-based recommendations that enable them to offer safe, effective, and acceptable services. This direct link also allows for critical feedback from the IB partners on their experiences with using our guidance, so that we at WHO can constantly learn and regularly update and improve the guidance. Let me give 3 quick examples of how our collaboration with IBP has been mutually beneficial. First, prior to the last update of WHO's medical eligibility criteria wheel, which is one of our most used guidance tools, IBP partners mentioned to us that they noticed that the pregnancy screening was not included in the tool, despite it being an essential factor to consider. Service providers had to first use another tool to screen for pregnancy before using the MEC wheel to determine the contraceptive options for each client. Through IBP, therefore, we learned what needed to be done and so updated the MEC wheel, which was also adapted for use in humanitarian settings, so that it now includes a pregnancy screening checklist within the tool itself, making it much more useful and efficient for health workers to use. As a second example, in 2018, IBP hosted the launch of the Family Planning Handbook in India and has continued to support its use over the years. The survey in 2020 of IBP members showed that the Family Planning Handbook was the most used WHO guidance tool by IBP partners. In fact, 70% of the respondents reported using the Family Planning Handbook regularly. Understanding how important this guidance document is to family planning organizations around the world, IBP will now be supporting the dissemination of the soon-to-be released 2021 update of the handbook in the coming months. Thirdly, feedback from IBP partners has told us that some were having difficulties in applying WHO's guidelines to country-specific programmatic practices and interventions. In 2020, IBP finalized a matrix tool to illustrate how the WHO guidelines can be used practically to design and implement specific family planning interventions, such as the high-impact practices. Matrix provides suggestions for how the HIPs, as they're known, and the WHO guidelines and derivative tools can be used together for advocacy, program design, as a provider reference, and during training. IBP, as you may be aware, has just launched the tool in December and will host a series of additional dissemination activities throughout 2021. So in conclusion, for WHO, this partnership with IBP is crucial for reaching and directly interacting with the intended audiences for our guidance. It also provides a unique and two-way communication channel for exchanging evidence and experience. This certainly benefits WHO, and we feel also benefits IBP's partners. This is why we continue to engage and strengthen our work with IBP and are delighted to continue to host this critically important network. Thanks very much, and back to you, Pat.
Hello. We're having a little bit of trouble here. Can you hear me? You can hear me?
We can hear you, Pop.
Yes.
Okay, it looks like it finally came back on. I missed most of Jan's. Okay, so let me go ahead and introduce our, thank you, Jan. Was having a little technical difficulties, but we'll go ahead and introduce our second panelist, which is Gifty Adiko. Gifty is chief of the Commodity Security Branch of the technical division of UNFPA, providing technical leadership and strategic directions for UNFPA on family planning and reproductive health commodity security. Gifty is a medical doctor with specialization in public health, focusing on reproductive health and family planning in developing countries. Her over 20 years of experience has primarily been dedicated to working with governments and development partners to set strategic priorities in sexual and reproductive health and family planning, and on strengthening health systems to meet the needs of the most vulnerable population. Gifty, over to you.
Thank you, Bob. Hello, colleagues and friends, wherever you may be. Good morning, good afternoon, good evening. Dear colleagues and friends, to achieve the 2030 Agenda of Universal Access to Sexual and Reproductive Health, it is crucial that we draw from, learn, and build on best practices. As a founding member of IBP, UNFPA is proud to celebrate 20 years of knowledge sharing and collaboration in pursuit of our common goal of improved reproductive health. Congratulations to all the many partners involved in this initiative. As you've just heard from the examples Ian shared, IBP has helped bridge the gap between evidence and guidance generated at the global level and the use of that knowledge to improve family planning outcomes on the ground. Importantly, IBP has also helped create a platform for field-based implementers to feed back their experience and learning into shaping guidance and defining high-impact practices. Just one example among many that we would like to share is the virtual discussion hosted by the IBP Knowledge Gateway with field-based implementers, including organizations of persons with disabilities. And yes, IBP was holding virtual discussions and consultations even well before COVID-19, as you would all recall. Inputs from the discussions helped shape the first WHO and UNFPA guidance notes on promoting sexual reproductive health for persons with disabilities, published in 2008. The inputs of IBP members not only helped identify how existing services can usually be easily adapted to accommodate persons with disabilities, but also how crucial it is to engage persons with disabilities within program design and monitoring. These are all principles that have been built upon as we adapt and develop guidance and accelerate programming to ensure that no one is left behind, and that progress towards the 2030 Agenda for Sustainable Development is inclusive and upholds rights. A key to the success of IBP as a global network has been its ability to evolve and adapt to the changing landscape of family planning. UNFPA is pleased to be supporting efforts towards greater engagement of civil society, particularly at regional and national level in this initiative. In 2019, UNFPA's Eastern Europe and Central Asia Regional Office was the host of a regional IBP partners meeting in Istanbul. 70 participants from over 40 different organizations from West and Central Africa and across Europe convened to discuss experiences, tools, and resources about sexual reproductive health and rights programming across the humanitarian and development nexus. By engaging local NGO partners in this meeting, we were able to hear from those working on the ground in Georgia, Lebanon, Syria, and Ukraine. They reminded us that transitioning from post-conflict or emergency settings to integrating into more stable health systems is not new, but rather an existing part of many country programs. These insights proved critical in informing the meeting outcome document, the 10 key issues to consider when programming across the humanitarian development nexus. These priorities have also been reflected in UNFPA's 2021 humanitarian action. And in this action document, we are also calling for more investments in local women-led organizations and youth organizations that work as frontline responders and change makers. Because we realize that prioritizing local engagement to develop solutions that are locally owned supports response to the SRH needs of populations that are affected by crisis. As we have heard throughout this forum, we are all struggling with the challenges and impacts of the COVID-19 pandemic. In April last year, UNFPA estimated that if severe lockdown continued for 12 months, over 50 million women and girls would lose access to family planning, resulting in an additional 15 million unintended pregnancies. Cases of gender-based violence were estimated to increase by over 60 million during the same period. Long-reaching impacts over the decade were also estimated, with 2 million more cases of FGM and 13 more child marriages as a consequence of the pandemic. We are grateful that IBP was able to be a platform for sharing knowledge about the situation, especially in the initial months when data and data collection were limited. IBP's network's webinar on COVID-19 and its implication for family planning services, offered in English, French, and Spanish and Portuguese, was the start of a conversation. And I know that many of these examples have been shared over the past 2 days. And we hope that these would inspire scaling up and replication in different contexts. As many of you know, as UNFPA, we have set in motion a strategic effort to achieve transformational results by 2030 in reducing unmet need for family planning, preventing maternal deaths, and gender-based violence and harmful practices. These transformational results are cornerstones for achieving the 2030 Sustainable Development Agenda and for realizing the ICPD program of action. But no one organization can do this alone. We need a multi-sectoral, people-centered, human rights-based, and evidence-based approach, identifying and reaching those who are furthest left behind, including adolescents, persons with disabilities, indigenous people, those facing humanitarian crisis, those with less education and lower incomes, and ensuring that everyone can fulfill their right to reproductive health. Stronger partnerships and coordination will improve reproductive health service delivery, capacity development, and supply chains. We are also pleased to share that in January, we launched a new phase of our UNFPA Supplies Thematic Fund, and this time, in recognition of the strength of partnerships, we are calling it the UNFPA Supplies Partnership. And this partnership will be guided by a strengthened governance model, which will foster shared decision-making with mutual accountability for results. At UNFPA, we look forward to further strengthening regional and country collaboration through IBP to push the boundaries in terms of innovation and scaling up and supporting, especially South-South learning. Thank you so much.
Sorry. Thank you, Gifty. Thank you very much, and congratulations again for the great role FPA is having in this program. Our next panelist really should represent an organization that, of course, need no introduction, because we all know the great role USAID has had on my own organization, IntraHealth, and in this field in general. So I'm delighted to introduce Ellen Starbird. Ellen is the director of USAID's Office of Population and Reproductive Health. She provides high-level leadership to the agency's family planning reproductive health agenda and portfolio, which is valued at approximately $600 million annually. And Ellen directs the office's $100 million program. Ellen has over 25 years of experience designing, monitoring, evaluating international family planning and reproductive health program. Ellen, over to you.
Thank you so much. Good morning, good afternoon, good evening, everyone. Thank you, Pop, for the introduction, and thank you to the IBP Network for inviting me to share USAID's appreciation for our work together. It's an honor to congratulate IBP on 20 successful years and to be here with my colleagues Ian, Gifty, and Fila. As the world's largest donor in family planning and reproductive health, USAID recognizes the critical importance of partnership. You're going to hear this word a lot over the course of this webinar, and we are a proud founding member of the IBP Network. IBP has been instrumental in bringing together diverse partners with varying perspectives to advance evidence-based SRH programming and guidelines. USAID and IBP have a shared vision to promote, elevate, and sustain local partnerships. The network has doubled in size in the last 5 years to over 80 international and local partners, and I commend the Secretariat's efforts to engage with and raise local partner voices within the platform. IBP has made impressive strides in digital connectedness, unveiling a new social media-inspired website and hosting a steady stream of webinars of important information. These initiatives have benefited family planning and the reproductive health community tremendously during ordinary times, and even more so during the current COVID-19 pandemic. In 2010, a survey of stakeholders revealed little consensus for what works in international family planning. In response, my office initiated the effort to develop the High Impact Practices for Family Planning, or HIPS, with the intention of reducing duplication, ensuring investments in family planning were evidence-informed, and building on prior investments. It quickly became clear that other development partners were facing similar challenges, and that the HIPS would be more relevant and beneficial if developed and supported by a partnership. Today, the HIP partnership leverages learning across a broad range of organizations, and the HIP briefs are widely recognized as authoritative syntheses of evidence for what works in family planning programs. The diversity and commitment of partners like IBP is what has made the HIP briefs so valuable as a public good. IBP is also a crucial dissemination partner for global resources and tools that are jointly developed by WHO and USAID. These tools help reproductive health providers take guidelines like the Global Family Planning Handbook and the Training Resource Package for Family Planning and put them into practice to provide high-quality contraceptive counseling to clients. As the work to advance evidence-based programming evolves, the IBP Network's innovative initiatives to connect people and to document and share implementation examples remain salient. IBP began the HIP IBP webinar series years ago with the idea of sharing the HIPs broadly. The webinars have provided a valuable platform for country and regional implementers to share their HIP implementation experiences with thousands of peers. Indeed, IBP's ability to convene hundreds of people at a time through timely webinars is well known, and the webinar's popularity is a testament to the network's reputation as a neutral platform for critical information. The IBP Network is also a steadfast advocate for local voices. Over the years, IBP has been at the forefront of hosting regional meetings, which facilitate local partners to connect and learn from each other. These connections also support global actors by gathering feedback on the HIPs and WHO's guidelines, which increases the value and relevancy of these products. IBP has consistently strived to provide information in a variety of formats and languages to increase accessibility. For instance, the HIP briefs are available in French, Spanish, and Portuguese, in addition to English, which is no small feat. With over 20 briefs and the need to professionally translate and review each brief in each language, the work is considerable. But the HIPs have become a public good in the family planning community, and we so appreciate IBP's contributions in making them widely accessible. In a new US administration, and as we look to a new decade and a post-FP 2020 vision for the family planning community, raising the profile and usage of the HIP briefs and amplifying local voices will be critical. The IBP Network has made critical contributions in both efforts and will remain an important partner as we move forward. Thank you.
Thank you, Ellen. And then our last panelist comes to us from the Philippines, or we should recognize that by this time it is close to midnight already. Our presentation is going to be given by Phila Magnus. Phila is the Director of Communications for the International Youth Alliance for Family Planning. Phila sits on the executive board of Care Fugees, an organization that works with refugee families in Malaysia, as well as the Youth Advisory Council of Child Helpline International. Phila is committed in ensuring that youth from all walks of life are granted access to knowledge and resources that they require in order to be able to form decisions and choices in regard to their autonomy and sexuality. Phila, I think we have recorded remarks. So let's go ahead and hear Phila.
Good afternoon and good evening, everyone. Thank you, Pap, for the lovely introduction earlier. As you all have heard, my name is Phila Magnus, and on behalf of the International Youth Alliance for Family Planning, IYAFP, I would like to first just thank the IBP Network for bringing so many great leaders together, and of course, for ensuring that young people are provided an equal opportunity to be speaking on this very platform today. It certainly goes without saying what an honor it is for us to be speaking alongside the greats of the family planning and the reproductive health landscape, whom without their existence and partnership, it's quite likely that our field wouldn't have reached the great trajectory we have found ourselves on. As one of the few global organizations that exist for youth, entirely led by youth, IYAFP plays a strategic role in elevating the voices of young people. At the very core of it, the basis of our work lies in the fundamental human right of all youth being able to access their sexual and reproductive health, rights, and justice. We leverage youth energy, creativity, and expertise to improve advocacy and set a fully youth-led agenda. With nearly 80 chapters around the world across a multitude of regions, our values-driven community and geographic diversity has positioned us as a coordinating mechanism for global movement building in sexual reproductive health, rights, and justice. Marking our entrance as one of IBP Network's newer member organizations, IYAFP is certainly excited to work with the network to continue promoting youth engagement and strengthening our advocacy by leveraging on the wealth of resources that the network provides in terms of evidence-based guidance in family planning and reproductive health, and of course, so much more. And if I could just take this opportunity to very well be upfront with you all here today, in a position where youth-led organizations still continue to struggle to be seen and provided with an equitable chance at succeeding, I'd say one of the most crucial things that allows for IYAFP to still stand several years on is the fact that we are not a product of ourselves alone. Partnerships and coalition building have been a part of IYAFP's method for bringing about transformational change, and without it, we know that there can't be true progress. Take, for example, our partnership with the Population Reference Bureau, PRB, that has led to our success of our Empowering Evidence-Driven Advocacy project that it's now in its 4th year, where we're now shifting to centering around sustaining efforts of improving the implementation of existing family planning policies, especially for those that support youth access to and usage of contraception, as well as to generate new funding and policy commitments for family planning in response to evidence-driven advocacy in 5 countries across Africa. Whilst we take pride in the excellence of our youth, we know we wouldn't be where we are today without the support of our partner. The reason as to why our network and the partners we have on the ground are so varied and diversified is because we have grown to understand that the nuances of expertise and needs of the global health, and by extension, the sexual reproductive health and rights and justice field, is not something that can be addressed via a generalized approach. No one-sized shoe will ever fit all. If there is one thing I'd implore for you all to remember, it's this. The work that we do is not a competition. Each and every one of us and the very many organizations and movements we represent, we each have our own set of expertise, strengths, and priorities, and yet not one of us are without faults or flaws or are equipped with tricks to never fail. So what exactly is the answer? Well, what greater success can there be than to have partners that fill in the gaps that we're unable to fill ourselves? It's no secret that many of us may very well be under-resourced and are likely competing for the same channels of funding, especially in times of the pandemic, where global priorities have shifted. But imagine how much greater our impact would be if we could rely, work, and collaborate with each other. We may all have different paths that we take, but our destinations at the end of it are very much the same. We all want a better future, a better reality, and a better world for everyone, everywhere. In a new world where connection and change is no longer what it used to be, the IBP Network provides us all with a continued opportunity to connect the dots and the ability to embrace lessons that will allow for us to propel further in the great work that we all do. IYFP has much to offer in informing and leading the work of IBP moving forward, and we're certainly keen to play a key role in the new structure and governance of the network. And so, I'd say let's leverage on platforms that the likes of the IBP network has provided us with and utilize it for the benefit of us all. Thank you.
Thank you. Thank you, Phila. And thank you all of our panelists. Unfortunately, the organizers informed me that we kind of ran out of time. We're gonna have to probably conclude. But I just wanted to, again, in ways of concluding, again, congratulate the IBP for indeed 20 plus years maybe of wonderful. I think to me, the IBP actually represent of generating public good. So thank you for all the great public goods you have created. And it takes special people to have and sustain such commitment, and the commitment to this platform from way back. Those of us who've been there at the beginning, remember the MAC initiative with Jim Shelton and others. So thank you for carrying on. In fact, this is so time that we can continue to use this platform. And as I said at the beginning, the question and the agenda is how do we accelerate progress so that we can get faster to the last mile, which is our common preoccupation. So thank you, Sarah, and over to you.
Thank you, Pop, and thank you to all of our panelists as well. It was wonderful to hear your unique perspectives on partnerships, so thank you for joining us today. Next, I would like to turn it over to Dr. Nandita Thate, who is the head of the IBP Secretariat based at WHO and lead of the IBP Network. Nandita, over to you.
Great. Hi, everyone. Thank you, Sarah. And thank you to our esteemed panelists for your insightful perspectives on IBP as we celebrate 20 years of this unique partnership. As Sarah mentioned, I'm Nandita Thate, and I lead the IBP Network Secretariat with my colleagues Ados May and Carolyn Ekman. We are thrilled to be hosting this session today with so many of our fabulous IBP partners. Many of you are very familiar with IBP, but we do have a lot of new participants with us. So I'm going to just share a brief overview of the network, including some of our more recent updates. Next. So imagine the world 20 years ago, long before Facebook, Twitter, social media. There was no video streaming, no WhatsApp, no Amazon Prime, and before knowledge management was an official university degree. Colleagues at WHO, USAID, and UNFPA were struggling with some common challenges. Guidelines were being published, but weren't being used consistently at a program level. Donors were funding one partner to develop a tool, only to find that another organization was developing almost the exact same tool. And there was limited engagement at a global level with our regional and country partners. So together with 9 other global organizations, they came together to create the Implementing Best Practices Initiative as a place to share tools, resources, guidelines, and other best practices in family planning and reproductive health. Over time, and as the debate over a best practice continued and continues today, the IBP initiative became known simply as IBP, and more recently as the IBP Network. We have continued to strengthen our partnership to include a diversity of stakeholders from ministries of health, academic institutions, international NGOs, and local civil society organizations to exchange evidence and support family planning and reproductive health programming. The Secretariat continues to be housed at WHO, which not only allows our partners direct access to the most updated guidelines and research, but also provides an important neutral platform for partners to convene. And thanks to our partners, especially USAID, WHO, and UNFPA, we've been able to sustain this partnership for 20 years. And much of our work, including the various communities of practice and tools that have been developed, have lasted beyond the life of any one administration, project, or funding cycle. Next. The timeline that we created showcases some key activities over the past 20 years, and we'll include a link in the chat so you can download it directly. I just want to highlight a couple of things. Starting in 2000, IBP organized regional workshops to mobilize country-level stakeholders. These regional workshops would be something that IBP would continue to do throughout the years, and others would also soon adopt for engaging partners for change. In 2009, IBP, along with the Gates Institute and partners, helped conceptualize the first ICFP conference in Uganda and actually organized the first implementation track. Since then, we have been honored and proud to be a key part of the ICFP conferences and look forward to many more in the future. In 2010, we helped to launch the High Impact Practices in Family Planning work, and we continue to support much of that dissemination and utilization today. IBP has also been uniquely placed to prioritize work with regional bodies. We've strengthened our work with FOROLAC and PAHO, providing a platform for colleagues in Latin America and the Caribbean to share new resources and tools in family planning and reproductive health. This was especially important in a region that had become less prioritized. And in 2015, we further strengthened our relationship with the West Africa Health Organization to help organize the first Good Practice Forum. That forum has continued under WAHO's leadership and has become one of the premier technical convenings in the region today. And most recently, we've actively engaged in the COVID-19 response by quickly convening a task team early on to ensure that the newest and most updated WHO guidance was shared with our partners, along with documenting important adaptations in family planning programming during the pandemic. Next. In 2020, we also underwent a strategy refresh process to revisit our strategic goals and governance structure. Through an iterative and collaborative process, we recommitted to our mission and vision with an added eye on ensuring representation, inclusiveness, and diversity among all of our member organizations. Next. We also strengthened our resolve around our three main strategic goals, which are to disseminate and share evidence-based guidelines and programmatic practices, support implementation, and of course, facilitate collaboration. Next. We also revised our governance structure to allow for an expanded governing body or steering committee, which will allow us to have better representation from our diversity of member organizations. And the chair of IBP, of which we have now had 10, will be a co-chair role, allowing for a wider range of organizations to participate and inform our work. Next. We are grateful for the commitment of our many partners and supporters over the years and look forward to engaging more with all of you in the future. Thanks to this continued support, IBP now includes 85 member organizations, many of which are local and country-based, and over 15,000 individual subscribers worldwide. Our network continues to leverage our platform to provide opportunities for regional and local partners to share experiences and evidence on a global scale and take this learning back to our global partners. We are excited to be publishing a series of IBP implementation stories in the coming weeks, and of course, launching our new community engagement platform to further support collaboration. Next. I will now turn it over for a short video that details our new platform a bit more. Thank you, and we look forward to working with all of you.
Thank you, Nandita. All right. So we are going to be moving into the next part of this. We're gonna see how much you all learned while Nandita was talking about the history of IBP. If everyone can pull out their phone and open a browser and go to menti.com, menti.com, and enter the code 8200992 when you get there. We'll give you just one moment to arrive. Once you get there, you should see this first question. In what year was IBP established? The year 2000 is heavily in the lead. Interestingly, Nandita and I had a little bit of back and forth on what the correct answer was here. Yeah, the correct answer is 2000. Well done, everyone. We're going to move on to the next question. What does IBP stand for? Does it stand for implementing best practices, inclusive, bold partnership, institutionalizing better partnerships, or all of the above? Seems as though we're almost unanimous at this stage. Except I'm guessing Nandita just chose all of these.
Thanks, Sarah. Yes, just to clarify, as I mentioned, there was always a debate about best practice. And so several years ago, the steering committee decided they would drop calling it the extended implementing best practices and refer to it just as IBP. But we thought, why limit it to just implementing best practices? Since we're all about creativity and partnership, we thought we would come up with some other ways to define IBP, including institutionalizing better partnerships, inclusive, bold partnerships, and whatever else you may decide. So we encourage you to be creative as you think about IBP.
Thanks, Nandita. All right, moving on to our next question. What organization was the first chair of IBP? So Nandita just shared a little bit of the structure of IBP. It's fun to see these lines going back and forth. USAID heavily in the lead. It's actually in gender health. So to the 15, 16 of you who chose in gender health, kudos. USAID was one of the founding members of, though. Our next question, which of the following is not one of IBP's main goals? Increase access to global guidelines, support implementation and documentation, develop biomedical technologies, facilitate collaboration and partnership. All right, what I'm getting from this is everyone is really good listeners on this session today. That is the correct answers. IBP does not focus on developing biomedical technologies. Well done, everyone. All right, Nandita also spoke to this. In 2000, when IBP first started, how many member organizations did IBP have? 20 years ago, how many did we have? 12 is in the lead, with 16 coming up behind it. Yes, the correct answer is 12. Now, currently in 2021, how many member organizations does IBP currently have? Again, a lot of really good listeners. Yes, the answer is 85 and growing. Many of those in the last several years have also, we've seen a large increase in the number of local partners joining IBP as well, which is fantastic. All right, next. Which global convening of public health professionals did IBP help conceptualize? Women Deliver, ICFP, the Global Health Mini University, or the ever popular Family Planning Palooza. I'm surprised more people didn't choose Family Planning Palooza, but yes, the answer is the International Conference on Family Planning, as Nandita spoke to. All right, so this is a bit of a different response. How strongly does our vision resonate with you? So you should see a slider on your phone, and you can, 1 is that you disagree with the vision, and 10 is that you strongly agree with the vision, which is global SRH guidelines and effective practices are disseminated and implemented to improve reproductive health outcomes around the world. And it looks like for the most part, this resonates with most people in this session, which should not be a surprise because I think many of our organizations have similar visions. All right, our last question, everyone's favorite. Please submit 1 word that describes IBP for you. Just 1 word. Inclusive and partnership, technical leaders, collaborative, sharing, inspiring. Partnership keeps getting larger, which should not be surprising. Knowledge, unity, diverse. Fantastic. All right. Well, everyone was a fantastic listener during the session. I hope that was fun. I think I've seen a couple of questions in the chat on how you can become a member of IBP. We have our resources here, the ibpnetwork.org. You can email the Secretariat, which is Ados and Carolyn and Ados here. And then this is where you can find them on Twitter. So next, I am going to turn it over to Ados May, who will facilitate our next partner update section. Ados sits at the Secretariat at IBP, and Ados, over to you.
Great. Thank you so much, Sarah, and all our panelists and partners. We're running a little bit behind time, but we want to have the next 20 to 25 minutes give an opportunity to our members who usually share with us in person their amazing work. So since we're not able to meet in person this time, we have set aside 90 seconds per partner, and we'll hold you accountable to that as soon as we start. So we will start with Matthew Wilson from PSI. You'll have 90 seconds, and after that, if you are still on, and this applies to everyone on the group, we'll have to mute you and move to the next person. So thank you, everyone. We'll be sharing links to these resources on the chat, so please make sure to check that as well. Over to you, Matthew.
Good morning, afternoon, and evening. Sustainability is something that we all wrestle with, both how to conceptualize it and how to achieve it, especially in time-bound projects and low-resource settings. A360 is a flagship investment by the Gates Foundation and SIF that works with health systems across 4 countries to improve the health, resources, and agency of adolescent girls. And this is how A360 is approaching sustainability. We look at it from 3 perspectives. At a client level, we're working to support adolescent girls not only to voluntarily adopt contraception, but to continue using contraception when in need, so that the impact of contraception is sustained throughout their lives. At a country level, we're working with host governments to institutionalize A360-inspired approaches, so service delivery is scaled and sustained long after the project ends. And at a global level, we're working to sustain the value of A360 to the wider sector by generating evidence and learning and supporting the adoption and replication of A360-inspired approaches elsewhere. These three perspectives and the strategies that flow from them are equally important, and they encompass three of the biggest challenges that we face as a sector: contraceptive continuation, institutionalization, and knowledge translation. We'd be delighted to hear from other projects and organizations wrestling with the same challenges.
Thank you so much, Matthew. Over to you, Caitlin.
Can you hear me?
Yes.
Great. Thanks, Ados, for welcoming me to speak today, and congratulations to the IBP Network for a successful 20 years. My name is Caitlin Thistle, and I'm here to share an invitation on behalf of the HIP Partnership. As Ellen mentioned earlier, the HIP briefs are widely recognized as an important resource for our community. They are a credible and neutral synthesis of the global evidence of effective family planning practices. This public good depends on the contributions of co-sponsors, which include the IBP Network and our partner organizations. HIP partners play a critical role in the development, review, and dissemination of HIP briefs. We're now looking for new partners who work in family planning and reproductive health, and joining is simple. HIP partners enjoy benefits such as the ability to network with other organizations in the partnership, opportunities to serve as and alongside technical experts who keep HIP briefs up to date, global visibility on the HIP website, which had nearly 80,000 visitors last year, and up-to-date access to HIP information through a quarterly newsletter. HIP partners are invited to attend annual partners meetings to contribute to priorities over the next year. Our next HIP partners meeting is scheduled for April 15th, so if you're interested in joining, contact us today at fphighimpactpractices.org/contact. Back to you, Ados.
Thank you, Caitlin. Over to you.
Hi, everyone. I'm Elizabeth Corley with Apt Associates. I lead communications for the Sustaining Health Outcomes Through the Private Sector Plus project. SHOPS Plus is USAID's flagship initiative in private sector health. It is funded out of the Office of Population and Reproductive Health, so a big focus on family planning. This is the last year of SHOPS Plus. So we're focused on our end of project. And as part of that, we have launched a new series, Accelerating Private Sector Engagement, which it consists of learning briefs that pull together our lessons from the past 5 years. We published one on public-private engagement. This month we'll have another one on quality of care, and in the spring, one on health markets and corporate engagement. Also this spring, we will host an e-conference in May featuring panels on health markets, using data to strengthen private sector engagement and health financing. Finally, in June, we will have an event to reflect on all we've learned and to signal the way forward to increasing access to and use of family planning in June. I hope you will join us. Thank you.
Thank you, Elizabeth. Over to you, Rita. Rita, are you there?
Sorry, I was muted and I didn't know, sorry. Can you hear me now?
Yes, please go ahead.
Yes, okay. to help close the gap in programming tailored to first-time parents, Pathfinder and the H2A project is proud to share 8 key insights, programs, and activity cards for working with first-time mothers, their male partners, and their older women relatives. So, what is different about this approach? Our package of insights offers a roadmap for influencing multiple generations through one program. We engaged with a diverse group of stakeholders, including influential male partners and mothers-in-law, and we addressed specific moments where interventions can make the greatest impact, not only for the FTP's health, but also for the well-being of the next generation. No matter where you plan to implement an FTP program or in what programmatic context, those insights should provide you with useful information as you design and implement your program. Over to you, Ados.
Thank you, Rita. Diana, please go ahead.
Hi, my name is Diana Copeland, and I work at White Ribbon Alliance. In 2018, we launched the global What Women Want campaign, a survey that asked women and girls what quality healthcare looked like to them. The 1.2 million open-ended responses we received have been categorized and analyzed, and will be available next month on whiteribbonalliance.org through the release of the What Women Want dashboard and advocacy toolkit. The dashboard offers an unprecedented level of access to the survey data to allow anyone, anywhere, to see exactly what women want when it comes to their healthcare. Using the dashboard, you'll be able to see what women demanded specific to family planning and contraceptive information, services, and supplies. And since the dashboard is totally interactive, you also have the power to search through every single response by the specific keyword of your own choosing. The dashboard will show you that what women want and are demanding includes sometimes the very basics, like basic decency, kindness, and respect when accessing healthcare at all levels. But you don't need to take my word for it, because the dashboard allows you to see what women told us in their own words. The results in the dashboard show us, too, that women want their voices to be heard, and their thoughts, experiences, and demands to be taken into account when policies are being made that impact them directly. We've asked, we've listened, and now we're excited to act with all of you in delivering on these demands to make sure that what women want is what women get. Thank you for your time.
Thanks, Diana. Over to you, Erica, from Safe Hands.
Actually, Ados, I'm sorry to interrupt. I think we're going to have Jason share his screen, because there's a black box while you're sharing, if that's okay.
Okay.
Thank you.
Hi, everyone. I'm Erica Boulanger from Safe Hands, and we at Safe Hands co-designed and piloted 2 mHealth solutions to improve family planning with our implementing partner, Reproductive Health Uganda. So the first one, we co-designed and piloted Ask RHU, which is a chatbot that uses artificial intelligence with and for young people. Ask RHU turns a mobile phone into a trusted advisor and asks questions, answers questions on family planning, unwanted pregnancy, and HIV and STIs. So young people can ask a question and get an answer. And Ask RHU answers questions related to family planning and GPS of the nearest youth-friendly clinic. We relied on evidence from the private sector to ensure that the chatbot does not replace SRHR services or information, but rather complement services and the quality of care. The second mHealth solution that we co-designed and piloted is a solar tablet for use in mobile outreach. So our tablets digitize IEC materials and capture real-time data collection using solar energy to recharge. And our user-driven pilot delivered mobile outreach to 2,000 people and confirmed that the tablets were acceptable and feasible. In 2021, we are incorporating user feedback with an aim to implement across Uganda. And we'd be delighted to hear from other organizations that are developing and piloting similar mHealth solutions. Thank you.
Thanks, Erica. Over to you, Sarah.
All right, next slide, please. I'm going to be sharing 2 sneak peeks that CCP is working on. Jason, you can go to the next slide. FP Insight is a user-driven curation platform that allows family planning professionals to save, curate, and share family planning resources published by anyone all in one spot. It's based on Pinterest, but developed specifically for our family planning community, and we'll be launching this in the spring. Second, Pathways is a discussion and prompt-based tool designed to facilitate insightful conversation between young people and family planning providers to ultimately equip providers to provide more empathetic and adapted family planning counseling to young people. And this will also be available in the spring through Breakthrough Action. Thank you.
Thank you, Sarah. Marilyn from WHO, go ahead.
Thank you, Addis. WHO is pleased to share 2 new chapters to accompany the current global handbook. If you could show the slide, please. Perfect. One on providing care during an epidemic, the other providing care for clients at high risk of HIV. The chapter on providing services during an epidemic highlights, first and foremost, that family planning services should be maintained. Secondly, medical eligibility does not change during an epidemic. Thirdly, some methods can be safely and effectively self-administered. And lastly, greater use of digital technologies may optimize access to care. Based on what we learned from the ECHO trial, the chapter on providing family planning services for adolescents and women at high risk of HIV first reminds everyone that all methods are safe for clients at high risk of HIV, with the exception of N9 spermicides. It also notes in high burden settings where HIV prevalence is greater than or equal to 5%, all clients should be offered or referred for an HIV test. For clients in low and medium burden settings, providers should give information to help the clients determine if they are at high risk of HIV and need a test. PrEP can be safely taken with all family planning methods. Condoms are the only method for dual protection against HIV, STIs, and unintended pregnancies, and that testing male partners for HIV has benefits for both women and men. Please do integrate and implement these new chapters into the work you do. Thank you.
Thanks, Marilyn. Over to you, Anita. And Jason, please move the slide.
Hi, everyone. This is Anita Dam from USAID's Office of Population and Reproductive Health. Today, I am excited to share with you a new technical brief on contraception for women at high risk of HIV, recently published on USAID's website. The link is on the slide and in the chat. This technical update is a direct result of the epidemiological evidence that emerged from the ECHO trial and the 2019 WHO revised guidance regarding the use of contraception by women at high risk of HIV. In conjunction with the latest evidence and guidance, this brief clearly states that women at high risk of acquiring HIV can use all methods of contraception without any restriction. This brief can be used at the global and country levels by family planning and HIV program managers and technical staff in the United States government, any ministries of health, national policymakers, and implementing organizations. Programmatic implications in the United States government response are also highlighted in this technical update, emphasizing priorities to continue dissemination of revised guidelines, improving method choice, and strengthening HIV prevention, including FP-HIV integration in settings with high HIV prevalence. This brief was produced by PEPFAR's implementing agencies and the USAID Office of Population and Reproductive Health. We hope this resource will be helpful to many moving forward, and thank you to the IBP Secretariat for the opportunity to highlight this key resource. Back to you, Ados.
Thanks, Anita. Next slide. Welcome, Sarah Boateng.
Hi, thank you, everyone. Hi, everyone. My name's Sarah, and I'm the founder of IGEA Enterprise, which is an NGO that aims to advocate for the investment into the quality education of girls living in rural communities within Africa. My mum grew up in rural Ghana and left school at the age of 12 years old to go and sell oranges on the side of the road. This was due to her experiencing period poverty and missed out on too much school to catch up. When I moved to Ghana in 2016, I saw the exact same thing affecting my mum 50 years ago happening to girls in rural communities. So I designed Menstruate and Educate, which aims to support girls to be able to attend school whilst on their period. We provide reusable period pads that last for up to 2 years to support girls to do this. From the implementation of this project, we've seen girls' monthly attendance at school increase and also their confidence at school. We also designed community workshops to community leaders, parents and teachers to be able to support them with knowing the importance of menstruation and how it impacts their girls' education. This year, we're going to be expanding to support over 500 girls in 5 new communities and deliver workshops to about 1,000 community leaders and members. We're always looking for people to partner and collaborate with, so please do get in contact on the website or email me or find me on LinkedIn. Thank you.
Thanks, Sarah. And unfortunately, I don't see our next panelist from Hesperian Health Guides. So we'll move to Christina Puig.
Hello, thank you. Yeah, my name is Christina Puig and I'm with the European Consortium for Emergency Contraception. In most European countries, we have 2 oral postcoital contraceptive methods directly available in community pharmacies, the newest ulipristal acetate and the levonorgestrel emergency contraception pill. In 2019, the European Consortium and UACT, we got together and launched a participatory survey. We visit pharmacies and asked about easy products offer, price, storage and placement, age and sex restrictions. The report we share here today presents the findings from 5 countries, Andorra, Bosnia-Herzegovina, Malta, Spain, and Sweden. Our sample is limited, but our main conclusion is that access to the highest standard of care in postcoital contraception remains uneven within and among countries, and that important differences persist. We propose a few measures to respond to this. The first one is to reclassify easy pills so that they can be sold without pharmacy supervision, to develop regional standards or guidance for easy dispensing, which detail what includes and should be included and excluded in an easy consultation, and to make these standards publicly available so that individuals are empowered to demand an interactions with pharmacy staff that is geared towards helping him or her make a choice on postcoital contraception rather than being told what to buy. We hope to do advocacy work based on this report in the coming year. Thank you for your attention.
Thanks, Christina. And we'll skip Population Media Center and go to Engender Health.
Yes, this is Candace Liu representing Engender Health, who is proud to be the first chair as well as the current chair of IBP. We want to take this opportunity to introduce the new launch of our new program called Momentum Safe Surgery in Family Planning and Obstetrics. Its technical focus areas include surgical obstetrical care, mainly cesarean section delivery, as well as post-peripartum hysterectomy. It will also focus on obstetric as well as iatrogenic fistula, voluntary long-acting reversible contraceptives, and voluntary permanent methods, including vasectomy and tubal ligation. Our partners include Intro Health, Johns Hopkins CCP, and the London School of Hygiene. The program is based on a theory of change that cross-cutting barriers often limit safe surgery, and that these barriers include barriers within the community, barriers within health facilities, barriers within health systems and institutions, and barriers in knowing how to gain access to data and to use that data. We look forward to, in the future, to sharing some of our findings, and thank you for this opportunity.
Over to you, Marisa, from FHI.
Thank you, Ados. This is Marissa Malkin from FHI 360, and I'm excited to introduce an interactive web-based resource that the Research for Scalable Solutions project is developing to share details and insights on how FP programs are adapting to the COVID pandemic. This product is still a draft, so this is very much a coming soon teaser. Last year, the ARFS project, FHI 360, along with partners PSI and Save the Children, began systematically documenting how 7 FP projects were adapting in response to the challenges of COVID and we also tracked changes in programmatic indicators over time. The projects were located in India, Kenya, Nigeria, Uganda, and Zimbabwe, and adaptations covered a number of areas, many of which are also high impact practices, including digital technologies, mobile outreach, and community health workers. We're currently building out this resource to share our findings, which you'll be able to explore through different pathways. For example, you'll be able to delve into the details of specific countries, projects, challenges, or by adaptation. And we really hope that this resource will bring to life how dynamically FP programs are working to both adapt and maintain resiliency in this reality. Thank you.
Thanks, Marisa, and thanks everyone for keeping on time. Our last presenter is Tenan Traoré from Equipop. Tenan? Just having one second. Elise, can you do the presentation?
Tenan is not connected?
He is, but not unmuting.
She is not connected. All right, so je vais la faire en français. En fait, Tenan, qui fait partie de l'Alliance Droit et Santé, qui est un mouvement qui réunit plusieurs OSC d'Afrique de l'Ouest, souhaitait présenter la campagne sur l'ECS qui s'appelle Je veux savoir et qui a eu lieu en 2020 et qui a permis de réunir un certain nombre d'acteurs, représentants de la société civile, représentants des gouvernements, mais aussi de mobiliser des artistes et des mouvements de jeunes. Vous en saurez plus sur cette campagne en allant sur les différents sites que Ados a bien voulu mettre sur le côté. Et j'espère que la prochaine fois, on pourra directement avoir nos collègues d'Afrique de l'Ouest pour faire cette présentation. Merci beaucoup.
Merci, Elise. Thank you so much. And over to you, Sarah.
Great, thank you, Ados. And we're coming to the end of our session, but I do want to pass it very briefly over to Kirsten Kruger of FHI 360, who is the incoming chair of the IBP Network, for just a few brief closing remarks. Kirsten, over to you.
Thank you, Sarah.
Merci, Sarah.
Hello, everyone. Is this coming through okay? I will, because we are running short on time, I'm going to say my connection to IBP has been parallel to my entire career, and certainly at FHI 360, where I'm a technical advisor in research utilization. And I think the most important thing that I have gotten through being connected to IBP is that it simply makes me more effective. I'll leave it there. This has always just been a group and a network that has been focused on action, focused on user-driven needs, and on using information. So that is what I have been able to take away from being a partner. So looking to the future as co-chair, we're super excited. FHI 360 brings 50 years of family planning, reproductive health, research programs, and research utilization. Our missions are very much aligned around disseminating evidence and supporting use of evidence. We have currently 3 family planning projects, which I know will be involved in some way with our next several years as a co-chair. That's Innovate, R4S, and Knowledge Success. So just a shout out to those groups. And the last thing I want to say is please be in partnership with us. We do need you. We want to continue the diversification to regional and local partners. That's something that Ados and Nandita have really leaned into in the last few years, and we want to foster more of that. If you're not leveraging IBP right now, you are missing out. So we need you to become a partner and also to make some space and some room in your work plan to contribute. I finally just want to say 20 years as a network, there really is no other network that can point to that kind of history, that has that kind of longevity. So when you think about the sustainability of a group and one that can help you and your organizations be more effective, it's incredibly impressive. And I look forward to the next 20 years. Thank you.
Thank you, Kirsten, and thank you everyone for joining us. Have a lovely afternoon or evening wherever you are.
Power to be seen across the world. We're not the future, we're the present. Invest in us and you will see the world is changing.
Because our bodies and the future we hold it. We want for you to see that everybody can win. Could it be education or contraception? Everyone will always be here to sing.
We are family and we are planning to go around the world telling everyone that we demand a voice. We are family and we are planning to go around the world telling everyone that we demand a choice. We on the ground in every area. We're the ones to make a world a better place. We want the best, we want the way. There's something for a future so bright.
Because our bodies, and the future we holding. We want for you to see that everybody can win. Could it be education or contraception? Cause the boys we always be fine.
We are family and we are planning to go around the world telling everyone that we demand a voice. We are family and we are planning to go around the world telling everyone that we demand a choice.
We gon' climb up and then rise up. Won't keep our eyes shut, we ain't got enough. I know you tired of seeing things the same way, but in time you realize that things change. We the demographic dividend. You see the work that we putting in. I'ma stay true to me and use my opportunity to show you how to build a community with unity.
உன் வாழ்வு உந்தன் கையில் எதிர்காலம் உன் கண் முன்னில் மனதையும் உடலையும் பாதுகாக்க காப்பாய் வேண்டும் வேண்டாம் என்று சொல்ல உனக்கு மட்டும் உரிமை உண்டு தேவையில்லா குழப்பம் நீக்க வெவ்வேறு பல வழிகளும் உண்டு உதவக்கரங்கள் உண்டு முன் வந்து சொல்வாய் என்று உதவக்கரங்கள் உண்டு நீ முன் வந்து சொல்வாய் என்று என்றே முடிவு செய் உடல் நலத்தை உயர்த்தி வை என்றே முடிவு செய் உடல் நலத்தை நீயும் உயர்த்தி வை.
Because our bodies and the future we hold, we want for you to see that everybody can win. Could it be education or contraception? Girls and boys will always be fine.
We are family and we are planning to go around the world telling everyone that we demand a voice. We are family and we are planning to go around the world telling everyone that we demand a choice. We are family and we are planning to go around the world telling everyone that we demand a voice. We are family and we are planning to go around the world telling everyone that we demand a choice.
Thank you all for joining today. We are going to close this webinar in 30 seconds or so. We encourage you to please join the closing plenary, which begins in 2 minutes. A link to the plenary session can be found on the Not Without FP Forum scheduling webpage, and a link is also in the chat. I'll be closing this webinar in a couple of seconds.